Last year, it's hard to believe that we did better than the year before across the board, no matter what you're looking at, whether it's the total number of operations, more than 8,000, or the results of these operations. We did better than we've ever done before, and we did better than anyone has ever done before. In adult cardiac surgery across Northeast Ohio, we had nearly 6,000 cases. In this campus, 5,254. About 7 or 8 years ago, Dr. Mihalovic asked me, do you think that you can do 5,000 cases? And I said, well, I can't, but this group of people likely can, and we broke right through that barrier. And we did it with outstanding results, meaning 98+% of the people who came here, whether they arrived on foot or by helicopter in extremis, more than 98% of them left this hospital alive. And that's reflected in our star rankings for the STS across all 8 categories. We are 3 stars, and I believe we may be the only program in the country that has this honor with these rankings. General thoracic surgery, same story, truly outstanding, 2,000 or so cases across the entire spectrum of everything general thoracic surgery does. When I go in and see the robotic cases that Dr. Murthy is doing, Dr. Raja, I notice the heart beating, but they're doing everything. I say that the beating thing you can handle, but we'll take care of all the other things in the entire rest of the body. And they do, with outstanding results again. The patients know their individual results and they know how their experience was, and they rank us in blue well above our target, meaning almost all patients say we are at least 9 out of 10. And virtually 100% of patients say, after being at Cleveland Clinic, I would recommend that anyone with a problem like mine go to the Cleveland Clinic. And it turns out that people from all over do go to the Cleveland Clinic. Most hospitals serve their local community. We do that, but we do that plus. Only 16% of our patients come from Cuyahoga County, 31% from the 20 surrounding counties, and 14% from Ohio in general, so people driving from Columbus, Cincinnati, Toledo, Dayton, et cetera. But more important to us and to the entire country, almost 40% of our patients come from basically every state in the union, including Alaska and Hawaii, and from 32 other countries for cardiovascular care. So we are truly an international resource. And with all of these people, this group, thoracic, cardiac surgery, congenital surgery, is responsible for about half of all of the admissions to this entire building, which is truly tremendous if you think about the fact that each one of our patients is complex, requires a stay in the operating room, ICU, on the floor, and we fill this building with these patients. And now you'll hear from each individual surgeon in a bit more granularity about what we do, how we do it, and how we serve just every single patient who comes from Ohio, the country, and around the world.